for doing this.
Awesome. Thank you for talking to me. I'm so excited to do this. I just wanted to double check really quickly before we get into it, because I would hate to spell your name wrong. So could you just double
it's
check
what's on the it's what's on the screen. If it's coming up at your end, so Katherine, Gill, can you see that? Does it come up your end? Yeah, so that's what it is.
All right, cool, awesome. And how do you like to be introduced? Do you go by Dr. Katherine Gill? Do you go by, FND, Australia Support Services runner? What do you like?
Yeah, people often say Dr. Kate Gill, and president of FND Australia Support Services.
All right, easy. Magic.
Awesome.
Alrighty. So I really wanted to just start entry level with just some basic foundational information, like in your words, when you're talking to people about it, how do you describe FND?
Okay. So FND is a very, very misunderstood condition, which presents with severe and disabling neurological symptoms, which can range from an inability to walk, gait disorder, paralysis, tremors, abnormal movements. A number of people will experience prolonged seizures. People might lose their vision, lose their hearing. So the symptoms are all neurological. There has been, it has been classified under the mental health diagnostic criteria. It was originally, thought to be a mental illness where people might have been converting psychological trauma into a physical response. And they were theories that were developed around the 1800s when they didn't have a good medical explanation for what might be underlying the FND symptoms. More recent research, there's been a lot of work studying the brain now. Really in the last 5-6 years, there's been a lot of effort finding out what's going on in the brain of people with FND. And what we're seeing in the brain is changes in the way the brain functions. So it's now thought to be, the name has been changed to functional neurological disorder. So a problem in the functioning of the nervous system. And so a person may not have structural damage to the nervous system. So the brain and the spinal cord might look okay when you do a traditional structural MRI.
Is that, when you, sorry, I just wanted to, because I'm not very good with medical science stuff. With that damage that you're talking about to the structural nervous system, is that a sign that you would often see in other similar conditions?
Yeah. So things like MS, a lot of people will present with symptoms similar to MS. But with MS, if you do a scan of a person's brain with MS, you'll see lesions which might then relate to the symptoms that the person has. Whereas in FND, we may not see changes like that in the brain, but yet the person presents with very similar symptoms. But what we see with FND is changes in connectivity in the brain. So the way different parts of the brain communicate with other parts of the brain. So there might be a connection between the emotional center of the brain, so the amygdala, and the way that it talks to the motor part of the brains. So that if the person has an emotional response, it might trigger a paralysis episode. So we do see changes in the way the brain functions. There can be underactivation of the motor system in people with motor problems. People with vision problems, we see an underactivation of the visual cortex of the brain. So what they see when they study the brains of people with FND does relate to their symptoms. So we can actually see what's going on now. But this is not done in the traditional routine medical testing. It's done in the research laboratory. So if you present to hospital and they do an MRI, they'll do a structural MRI and they'll go, oh yeah, your brain looks okay, nothing wrong, go home. Yeah, you don't see it. But in the research setting where they're delving much deeper, they're starting to see what's going on now.
So would it be promising in the future to be trying to get that, that test for people who do show up and present those problems?
I mean, it would be wonderful if there was a biomarker for FND, and I'm sure, you know, at some point in the future there will be some type of biomarker.
Yeah.
But I would say that's a long way down the track, and probably not in the duration that many of us are living in. The functional MRIs are they're not routine tests done in hospitals. It's done in the research laboratory.
Right.
Yeah. So we've got a while to go.
Yeah.
In terms of diagnosis, there are traditional signs that neurologists might use, so positive signs that neurologists might use that might indicate that it's a functional problem. Yeah. So there's like differences that they might detect between a person with an epileptic seizure and a person with a functional seizure.
Mm-hmm.
If a person has a functional limb weakness, there's a Hoover sign, which is just a muscle testing that a neurologist might do, and that might indicate that it's a functional issue.
Oh, all right. That's very interesting.
Yeah.
So what is the usual like prognosis after a patient is given a diagnosis? Do they have like a good treatment plan? Do they get?
Yeah. Well, I mean, ideally a person would be diagnosed on symptom onset and then undertake a comprehensive multidisciplinary treatment program. That's not what we see happening. As you'd be aware, that treatment programs for FND are sort of few and far between. There's one treatment program for kids with FND in Sydney. So we've got people relocating from interstate to Sydney to access that program. There's really a lack of specialised treatment programs for adults with FND.
Yeah.
A number of people, we know that early diagnosis leads to the best prognosis, but yet a number of people have gone for years without a diagnosis. You know, some people up to 20 years sort of going around the medical system looking for an answer to their symptoms and not getting anywhere.
Yeah.
I tend to see diagnosis happening earlier now, but it's still many people have sort of had to go through a lot of testing and a lot of sort of heartache before they come to a diagnosis.
Yeah.
And ideally, once the diagnosis is made, a person would go into, you know, a comprehensive treatment program, but that doesn't always happen. We often see a lot of people present to emergency. They may eventually get a diagnosis at some point, and then a lot of people are sort of sent home from emergency with no treatment plan.
Yeah.
They may be referred back to their GP, and traditionally the GP would say, I don't know what this is, I don't know what to do. And we're just seeing so many people slipping through system gaps. Sometimes they might be referred to, oh, this must be, you know, they're told it must be in the head, go and see a psychologist, which doesn't solve the problems around the gait disorder or their paralysis. So if a person is presenting with physical symptoms, like they can't walk, they will need physical rehabilitation, and they'll need specialised neurological physical rehabilitation, and by a clinician that understands FND and understand how the treatment for FND might be different to, say, a stroke or Parkinson's or MS.
Right, yeah. So it's actually specific to the condition that they're working with.
Yeah,
definitely. Yeah. So how, because you mentioned that the prognosis is better the earlier the diagnosis.
Yeah.
What is like the range in difference there? Like how much better and how? Like in what ways is it better?
Yeah. So we tend to see children have better outcomes than adults, and the brain is more neuroplastic, 25 years and under. So that means that the brain is changing and developing. So the younger the person develops FND symptoms, the more likely they're to have better outcomes. In terms of adults, the outcomes can vary. You may get one adult that has a single incident, which is clearly related to, say, an identifiable stressor. That stressor goes and they may improve. But what we're seeing in our sort of support group is a lot of people are having ongoing symptoms. And there is research that came out of the UK, which did a long-term follow-up study. And they said at a 12-year follow-up of adults with FND, 83% of those people remain disabled. So they had ongoing and quite severe physical symptoms. So those outcomes don't look good. In terms of what we see, we did a study around January 2019 and asked people in our group, what did they feel their symptoms were doing? And we had about 40% of people said that their symptoms were getting progressively worse. About 33% of people said their symptoms were staying the same. 20% reported that they were improving, but they hadn't recovered. No one in our group reported full recovery. And about 10% reported that the symptoms fluctuate. So they would have good days, bad days. Some days they might be completely non-functional, and other days they might have a good day and they could be walking or whatever. Yeah. So, I mean, there is quite a spectrum. So older people generally might do worse. Their brain is less neuroplastic. If the person has ongoing other conditions, so ongoing physical health concerns, other neurological conditions, if they've had a lot of, say, mental health trauma, those things can lead to worse outcomes. And of course, having a bad experience in terms of trying to get a diagnosis, trying to access treatment, not being believed, all of those things delay recovery. So it does lead to poorer outcomes. So ideally, getting people diagnosed early and getting people into treatment.
Absolutely.
And having, I mean, like for any medical condition, early diagnosis and
it just makes sense,
early treatment, leads to better outcomes.
Absolutely.
And also correct diagnosis, because if a person had, say, been diagnosed with epilepsy, but it was actually functional seizures, that then can lead to, you'd get side effects of medication, they've been treated in the wrong manner. That can also cause problems as well. So getting an accurate diagnosis early on, and also treating any comorbid conditions. So if you have epilepsy and you have functional seizures, you need to treat the epilepsy and you need to treat the functional seizures. And treatment of any other coexisting problems. For example, some vitamin deficiencies might lead to neurological problems. So fixing up any of those abnormalities that might coexist can lead to improved symptoms. If there is underlying trauma, that might need to be addressed alongside everything else. So taking like a really holistic view is important. So understanding the person as an individual, looking at all aspects of their life, and individualizing treatment.
Wow, some of that was quite hard to hear, but very fascinating. Very interesting. Do we have like a good understanding of how many people in Australia are impacted by FND?
So there has not been good epidemiology studies worldwide. There are some older studies internationally, and we changed the classification for FND in the DSM-5, and that opened up the number of people who could be diagnosed with FND.
When was that one changed? Sorry?
Around about 2013.
2013.
So studies that were done prior to the DSM-5 classification, there was a requirement that a person had a psychological stressor or trigger to be diagnosed with FND. Now, a number of people don't. A number of people developed FND after surgery, after an injury, after an accident, pain, medication, something. So when the diagnostic criteria was changed, that then increases the number of people that can be diagnosed with FND. So there are very limited studies on epidemiology. There's a great need to do more studies, more accurate studies. There is some data which is older, and I would say it's very underestimated because a lot of people are going undiagnosed, and there's reports, they vary. So around up to 50 per 100,000, I've seen 33 per 100,000. So that would equate to several thousand in Australia. But given the size of our support group, I would say there's probably a lot more people living with FND that are undiagnosed and people that haven't been captured in any statistics.
Right.
We do know that it is the second most common reason for a neurological consult after headache. So in terms of the number of people presenting to neurology, it is very, very common. You know, one of the most common conditions that a person might have when they have neurological symptoms. So it's more common than conditions like MS. So a very common condition that, very common condition that is under-recognized. And it's really lagged behind, like the research for FND has really lagged behind other conditions, which has of course impacted on patient care.
Yeah. Why would you say that it's lagged behind? Because I know from what I know and from what I've been reading, there's like 4 points that I think might be attributed to that lack. Why it's been lagging behind.
So it's sometimes classified as a neuropsychiatric illness. So it's slipping through the gaps between neurology and psychiatry. You know, the symptoms are neurological, it's classified under psychiatry. So there's been a lack of ownership between what discipline is going to look after people with FND, who's going to be managing this condition. So historically, you know, neurologists will go, this is mental health. Mental health will go, these symptoms are neurological, it's physical, go back to neurology. So people have sort of slipped through system gaps, and there has been a lack of interest. Sort of psychiatry go, well, this is physical, you know, it's not us. We work with, you know, the feelings, the emotions, the behaviors. And there's been, with neurologists, you know, FND's been unpopular. They haven't particularly wanted to work with people with FND. They've sort of diagnosed and palmed people off.
And why, why do you think it's unpopular?
I mean, Dr. John Stone did a study around 2010, and he compared MS and FND, and his outcomes were 95% of neurologists were happy to work with people with multiple sclerosis. 5% were happy to work with people with FND. And then in terms of public awareness, it was around 97%, say, of the public knew about MS, and 2% of the public knew about FND. So there's just been, neurology is particularly, you know, with the brain, and a lot of doctors, they like to sort of see something on a scan and work on scans and blood test results, that sort of stuff, work with something quantifiable. And because the traditional test used has not detected FND, so neurology might go, well, we didn't see something in the brain, so it must be in your mind, so go to psychiatry. So there has been that lack of ownership. And there's been a lot of myths that have come down around FND. There's a lot of stigma. There's some fairly negative things that I've seen documented around people with FND in various literature.
Would you say that's medical literature?
Oh, yeah.
Yep. Sorry, could you just kind of elaborate a bit more on that? Is it stigmatizing? Or...
I mean, it's very stigmatizing. I have seen some almost, I think people would, I saw it as insulting, things around secondary gain, primary gain, manipulative, attention seeking, malingering. Very, and in some papers, that kind of language is still being documented. There are still some thoughts around attention seeking. They talk about symptoms only arise in the presence of significant others, which is not true. So there's a lot of theoretical concepts that have come down since Freudian times, since the 1800s, and that continues to impact on patient care. It continues to impact on the way people are treated when they reach out for help. And the comments that have been documented around gain are in stark contrast to the reality of the illness. So when you speak to people with FND, the grief and the loss is enormous.
Yeah.
So people have lost, really, they're executives, they were all sorts of careers, working really, really well, great careers, earning money, family, children, all these things people used to enjoy. People might have been pushing their body in sport competitions, in dancing. Often people, that sort of perfectionistic person that would push their body to the limits.
Yeah.
So those people do not want to be ill. They do not want to be not able to work. People want to continue their life roles. We've seen sort of catastrophic impacts around people having to liquidate businesses, people having to sell their homes and relocate, people losing their jobs, not able to live, not able to pay the rent because they've lost their jobs, and all of a sudden their financial situation has changed. And then that adds another layer of enormous stress, because not only are they dealing with disability, they're dealing with financial stress. And they've lost all their life roles. So when you talk to people, you will see like this enormous loss and grief associated with that loss.
Absolutely. That kind of leads me back to the conversion disorder and how it was, thought to be turning trauma, emotional trauma, into physical symptoms. But then the brain imaging research is sort of not in agreement, would you say, with that theory?
Probably, yeah. And we do know that trauma is a risk factor for FND. So early childhood trauma does impact the developing brain. So it's a risk factor for FND, but it's not the only reason why you might get FND. So there's at least 30% of people with FND will say they've had absolutely no trauma. They've had good lives. They have not been exposed to trauma. So trauma is a risk factor. There is a greater level of childhood trauma in people with FND than the general population, but trauma is common, unfortunately.
Yeah.
So there's a lot of people in society who have experienced childhood trauma, who've experienced adult trauma, who've experienced complex trauma, and they don't come down with FND. So it's only one of several risk factors for FND. And in the same way that smoking is a risk factor for stroke, smoking is a risk factor for lung cancer, but you can get stroke and lung cancer having never smoked a cigarette in your life. So it's just one risk factor.
Wow.
And I would say, historically, they didn't have a biomechanism for FND. So they developed theories that might explain a case study. And it was a theoretical principle which they have continued to apply to people. And when you're told that you have a repressed trauma that was so severe that you can't remember it.
Can't even remember it.
Yeah, and that's why you have this physical symptom.
Yeah.
That can be quite traumatizing in itself, to think something's happened to me that I don't remember.
I don't even know what happened.
Yeah.
That would be really confronting.
It is. And also we may be creating trauma in people that it never happened to.
Absolutely.
So there are people with FND who haven't experienced trauma, that the family doesn't believe they've experienced trauma.
Yeah.
And again, trauma is very individual. It's basically when the stressor overwhelms the person's ability to cope.
Yeah.
So what's traumatic for one person may not be traumatic for another person. So trauma is individualized.
Yeah.
But it is only a risk factor for FND. It's not the sole answer.
So there's the Awareness Day coming up. That's exciting.
Yeah.
Would you say that this misunderstanding between the conversion theory and the brain imaging, and that the not understanding of the misunderstood nature of FND, do you think that's contributing to the lack of awareness?
I think so, because the research is in early stages with FND. So, these brain imaging studies, they're recent research. So what is published in scientific journals is not always accessible to the general public. It's not always accessible to clinicians who have trained a number of years ago or decades ago. And so the clinicians are not always up to date in every research paper coming out for every single medical condition. So people may have trained 20, 30, 40 years ago, and they might have learned about the conversion disorder theory. So they keep applying that. And they may have other areas of speciality, and they don't keep up to date with, me as a clinician myself, I have areas that I specialize in, which is obviously one being FND, but there's plenty of other conditions that I'm aware of, that I work with people with those conditions, but I wouldn't be up to speed with, you know, every single paper coming out in the research setting. So in terms of the awareness state, it's really important to create awareness of FND, you know, with what you're doing.
And would you say to create the awareness, because this is a big part of, I think, the awareness, is the goal specifically, not specifically, but the big part of the goal is to be more aware of FND in medical circles?
And in the general public.
And in the general
because
public.
It is a misunderstood illness. So people have had negative experiences in the medical setting because of lack of awareness. People have also had negative experiences in the community. So going to school, some people have to fight to be allowed to go to school because the school is, say, concerned that they might have a seizure at school or they might have problems getting up the stairs. So there's been a risk aversion. So I'm doing quite a bit of work with schools around inclusion of people in schools. So if they don't know about it, they don't know how to manage the situation. In families, so carers, they're under a lot of strain themselves, and I'm often contacted by carers who say, you know, I've been told one thing, but my gut tells me something else, and carers are overwhelmed. And you've got carer burden, carer stress, and when people are diagnosed, they're not given a lot of information. A number of people are not even given the diagnosis, myself included, but a number of other people have also reported that they found their diagnosis in their medical notes. So they presented to hospital, they were told the scans were clear and they were discharged home. And then when they eventually read their discharge summary, they'll find they're actually diagnosed. And one, that diagnosis wasn't told to the patient, and two, it wasn't explained. So I know for myself, I was initially diagnosed with a stroke. It was then determined that I hadn't had a stroke. So at first I was telling people I'd had a stroke. Then I was telling people we didn't know what was wrong because I'd gone for, they said, oh, it wasn't a stroke. So we don't know what's wrong because your scans are okay. But while I was telling people we didn't know what was wrong, there had actually been a medical document recording a diagnosis of FND, but I wasn't aware of it. I later got hold of those records and found my diagnosis that had been made 18 months earlier. And for me, having a diagnosis was important because then I could read about it. I could work out how to manage it. I could reach out to other people with FND to find out how they're managing it, and reach out to professionals who know about FND and learn about it. So the diagnosis process is important. It should not be withheld from a patient or their family. And it needs to be communicated, and there needs to be a level of education. What is this diagnosis? What does it mean? How do we treat it? How do we manage it? How do we stop it getting worse? So not having that conversation between a doctor and a patient is, to me, it's harmful. And it's withholding the opportunity of that person to get the relevant treatment.
Because it's so much more than just peace of mind, knowing what the diagnosis is. It's like actual actionable steps after that.
And look, I've had people that, you know, presented with very, very severe symptoms and they thought they were terminal and that they were going to die. I mean, that crossed my mind at one point as well, because I ended up in a hospital with sort of 90-year-olds and people were dying around me. And I'm like, you know, is that going to be my fate for the next little while? So, you know, it can be like you said, peace of mind to go, okay, this is the condition I have. It's not terminal, and I can learn to live with it.
Yes.
Yeah.
Wow. I was also wondering, do you consider there to be a sort of national toll on Australia for the lack of awareness? Like, do you think that there's a waste of taxpayers' money? Do you think?
Well, there was actually a paper published a couple of years ago in Melbourne, and it was just looking at functional seizures and the cost of the economic cost of people being diagnosed with epilepsy when it was actually a functional seizure. And the economic cost on that was very significant. But obviously, I mean, we're seeing people basically end up permanently disabled because they didn't get early treatment, they didn't get early diagnosis. And had they had that, they may have improved, they may have recovered.
Yeah.
But without that, a lot of people with FND are ending up on the DSP. They're not able to work, and they're ending up on the NDIS with quite high support needs and expensive equipment. So by not providing early intervention, really, it's leading to people becoming permanently disabled. And obviously there is an economic cost if people are no longer able to work. And then they have to draw on the welfare system. Obviously there's an economic cost. So the cost benefit is significant. And we know in mental health, sort of early intervention, there's a significant cost benefit for early intervention rather than letting people end up, with long-term mental illness. It'll be even more so with FND because of the impact of the physical symptoms and the physical disability, which impacts people's lives so dramatically, but not only the person with FND, the family of the person with FND. So if it's a child that has FND, we see carers not able to work. So they're losing their jobs because they're always being told to go and pick up the child from school. Carers who are in that full-time caring role where they say, I can't leave my child alone because my child will, have a seizure and hit their head and get injured. So we know that seizures cause injury. Seizures can also result in death in some situations. So obviously the carer burden is quite significant, whether we've got a parent looking after a child with FND or we've got a partner looking after the other partner. So the partner might become the full-time carer. So when you consider all of those different cost aspects, the medical costs, the disability costs, the loss of employment and the loss of employment for carers, there would be a really, really significant cost burden of FND and the failure to provide early diagnosis and early intervention.
Wow. Yeah, that is quite significant. That seems like quite a concern for the national situation.
I really think if there was more professionals were aware of the condition, able to treat it, understood how to treat it, understood how to work with people with FND, and people could get diagnosed early and get really comprehensive treatment without that sort of stigmatizing attitude. A lot of people do feel stigmatized when they reach out for care and they feel abandoned, let down, discharged with no medical care. If we could address those issues, I think we would see a lot better outcomes. And while the prognosis for FND, like that 12-year follow-up study reported 83% of the people with FND remained very disabled, what if the people were getting the gold standard treatment? Would those outcomes be a lot better? And I'm quite sure they would be.
Yeah. Because it just follows like a logical train of thought. Like, of course.
Yeah. And also with FND, because there is no structural damage to the nervous system, they say people with FND retain the potential for recovery or the potential for improvement. So if you have a spinal cord injury and your spinal cord is severed, you're much less likely to regain the use of your legs because the spinal cord is actually damaged. But if you have a problem with the connection of your nerves between your brain communicating with the rest of your peripheral nervous system, if you can get that working again and increase that connectivity between the brain and the body, you do have the chance to recover because there is no structural damage. So it's really got the greatest potential for recovery of any neurological condition, and yet it's the least treated and the least known about.
I have never even heard about that recovery potential before.
Yeah.
Like I've heard about most of these things, like bits and pieces, but that's just, I've never.
And when you think about that, because there is that potential, because the nervous system is not structurally damaged, we should be investing and investing and investing in this condition and people with this condition to maximize that potential so the person has the greatest chance of recovery. But sort of abandoning the person going, oh, we don't know what's wrong, you know, everything's fine, go home, work it out yourself.
Yeah.
That's just creating this disability, you know.
Yeah. That is very concerning. Is there any group still developing the conversion theory? Is there anyone still working on that?
I would say in the literature, in parts of the scientific literature, there are still trains of that coming down. I mean, we do know in FND, when we do look at the brain, there is overactivation of the amygdala, which is that stress response. And there is interaction between the amygdala and the motor part of the brain. But in terms of that sort of amazing conversion response where this repressed trauma is coming out in a physical response, that theory, it is still being promoted to some patients when they present to care. So, and people are still being told that something horrific happened to them that they don't remember. And even worse, people being told, you know, they were sexually abused or they might have been sexually abused by a family member, but they don't remember it. And if people have experienced trauma, they are likely to remember that they were traumatized, that something happened to them. So that repressed, and if the person does not relate to a trauma theory or a conversion theory, trying to put that model on a patient is not going to work. You've got to work with what the patient believes and knows about themselves. So we often say the person is the expert in their own recovery and the person is the expert in their own body. So if trauma is relevant to you, then you do need to work with whatever trauma might be holding your recovery back. If trauma is not relevant to you, it's no point sitting with a psychologist trying to work out what happened to me that was so traumatic that I don't remember.
Makes sense.
So again, that individualized care is what's needed. You work with that person and also where that person is at in that point in time. If they have experienced trauma but they're not ready to address it, forcing that person to address it is not helpful either.
Counterproductive.
Completely. So it's working with that person with where they're at and what their needs are and what they're able to do at that point in time.
Makes sense. So then, are there any, because Awareness Day, and we're trying to promote that, are there any particular professional bodies or groups that you would like to see step in or have the, you know, opportunity to step in and actually do like a significant amount to create resources for FND to help? Who would you like?
I mean, I would like to see, I mean, we do need more resources, and obviously, you know, our organisation is, you know, it's an unfunded organisation, so we're limited on what we can do. But we need the input of, you know, the College of Psychiatrists. We need the input of the Association of Neurologists. We need these professional bodies all coming in and all taking ownership. So instead of saying it belongs in some other discipline, it belongs in all the disciplines, you know, so psychiatry, neurology, physiotherapy, OT, and speech. For some people have speech and swallowing issues. So we need every professional body to get involved and to understand this condition, And also psychology. People are referred to psychologists, and some psychologists haven't heard of this condition. People are referred to speech therapy, and some speech therapists have not been trained in this condition. So we need all of those bodies to take ownership and to get on board.
Big task.
It is.
It is. Do you think it's the developing research and the misunderstood situation that's stopping them from getting involved? Why do you think that they're not stepping in?
Too often it's been, that's the responsibility of someone else. And there's a lack of understanding about FND. There's a number of myths that's still portrayed. Are these patients difficult to work with? There's a lot of stigma associated with, especially with the historical theories. So I think just understanding, validating the person and understanding that this is a real condition, and we do not know everything about the body. So while there's been some amazing advances in medical care, medical treatment, and medical diagnostic tools over the past 100 years, that has lagged behind with FND. And I would say more recently, the last 5 years or so, last 10 years, there's been a lot more interest in FND as neurologists have got on board and sort of started to realise that, this is a real condition. And of course, there are a few champions of the field, but we need more champions, coming on board and sort of going, we need to address this. This is a problem, and especially, as I said, because this is the most treatable neurological condition, we do need to treat it to give the best chance of recovery.
Absolutely. Do you have, who would you say are the champions that you would like to see, first jump in? Who are the big players that would have a big impact?
Neurology, because the condition needs to be diagnosed by a neurologist, and the symptoms are neurological. So we need to either exclude any other neurological conditions like MS, stroke, Parkinson's, epilepsy. Now, functional symptoms can coexist with other neurological symptoms, with other neurological conditions. So a person can have Parkinson's and FND. They can have epilepsy and functional seizures. They can have a stroke and FND. So if you have a neurological condition already, you're at greater risk of developing FND. So a neurologist is required to be on board in terms of managing the condition, monitoring what's going on, managing any change in condition. So we definitely need neurology, and ideally neurology should champion this condition, but we need the other professional bodies.
Are you talking about the neurological community, or are you talking about a sort of head organization running neurological that has influence in that area?
Both.
Yeah. So if it's the group that has influence within that field, who would that group be?
Probably, the Association of Neurologists. Sort of looking at those head bodies, and then it's not like everyone can make a difference. Even things that you're doing, people with FND can make a difference. So everyone has the chance to create FND awareness within their sort of community. So if everyone did that, and everyone sort of started communicating the right information about FND, the right education around FND, we'd start to see change. If we put it onto one single person or one organisation or one single body to do it, and it's not enough. The more people that get on board, the better.
Absolutely. Makes sense. Do you think, I don't want to press you to name names, but I think being able to note these different associations would be quite helpful, especially because you say knowing that it's not just putting pressure on one area. It's, there's a whole range.
Yeah. And we know, I mean, FND requires a multidisciplinary team.
Yeah.
So it's not kind of like one professional body can't work in isolation without the other, because I mean also the symptoms are quite broad, from speech to vision to motor to seizures. So the symptoms are quite broad. So we do need everyone to come together, or the relevant parties to come together and work collaboratively and address this problem. Yeah. And that crosses that divide between neurology, body, mind.
All right. So with the Awareness Day then, how can people get involved with it? How does the general public be a part of it?
I think what we're seeing, I mean, there's been a wonderful effort this year with people coming together and everyone sort of contributing in their own little way, in their own little community. Yeah. For some people, it might just be sharing posts on social media and reaching their community. Yeah. We've got people talking to, their health professional bodies, people talking to, the ambulance organisation. Yeah. So anywhere where people can create awareness within that sort of their local community, within their sort of locus of control. We've got people at university who are doing talks at university and promoting all the flyers for university. Oh, cool. So when we have lots of people involved, which is what we've seen this year, which has been really lovely, like the impact is much more significant than if we just sort of put it onto one person or one body and say, you need to do this. The more people that get involved and sort of target their own connections, the greater impact we're going to have.
Awesome. I think that is just about everything that I wanted to go over then.
Okay. Well, thanks so much for, creating your little FND awareness and doing this interview. Everyone doing something is fantastic, and promoting it where you can, and we'll certainly promote it through our networks as well. But yeah, it's been great talking to you.
Awesome. Thank you so much for taking this nearly an hour to talk to me.
Yeah, no,
it's been a huge help. So thank you so much for that, Katherine.
Yeah, no problem.
Great. Okay, all right. Thanks. I'll let you get on with your day.
See you later. Bye.
Yeah.
Bye.